Dr. Evans joins us again. Doctor, good to have you with us. Had a lot of questions for you over these many weeks. First of all, happy Hospital Week. What is going on with Happy Hospital Week?
Walt, thank you very much, and happy Hospital Week to you and to everybody that works in hospitals all over the area. It's been different. It's been a very different year with Hospital Week. Normally, we would have, big celebrations, get outside, gather together in large groups and really celebrate, what we do to take care of the community. It's been harder to do that. It's been harder to gather. It's kind of a weird year. It's a weird time. But what we're trying to do is make sure that we express our appreciation to everybody that works in the hospitals and thank them for what they do every single day. And also with this year in particular, thank them for their flexibility and their willingness to just pivot and do what is necessary to take care of their communities with COVID-19. A lot of adjustments. And so thank you to everybody that's out there that works in hospitals.
All right, first question for you, Doc. There's been a lot of gear to buy, a lot of preparations hospitals have had to make. It's cost a lot of money. What about CARES funding? Has that helped out hospitals like yours at all?
Well, the short answer is yes. It's definitely helping out. And CARES funding, this is federal money that was allocated by the federal government to help hospitals across the United States because of shortfalls in revenue. A lot of hospitals have had to decrease what they normally do with elective cases, testing, and all sorts of procedural things. And that's really created a financial problem in a lot of hospitals. So most hospitals are going to benefit from that in some way, and it's a relatively substantial amount of money. It's unclear exactly how much money we're talking about right now. There is some funding within CARES Act just for rural hospitals, which includes places like Sierra Nevada Memorial. We're considered a rural hospital. And so we'll get an allocation based on that. And then other hospitals will get money based on being in a hot spot of COVID activity. And a lot of those hospitals might be in New York. But I think it will be a significant help. I doubt that all that CARES money will completely offset the financial challenges of COVID-19, but it'll be a partial offset most likely. But I think it will be very welcome.
Okay, next one for you, Doc. Now that some counties have accelerated reopening, how are we best going to get the best picture of whether it's going well or not? Is it just based on how many people may be coming into your hospital that are testing or they're ill symptoms-wise?
Yeah, it's a very important thing to consider now because as counties, including counties like Placer and Nevada County that are starting to really move through into phase 2 pretty quickly here and open some of the businesses up partially, we need to know, how are we going to know if it's going okay? How are we going to know if we're starting to see more COVID-19 cases? And so this is where we have to work pretty closely with the departments of public health and have expanded testing so that we know what the rates are looking like if we're starting to see a lot more COVID-19 patients in the community. Certainly, if we're seeing more hospitalized COVID-19 patients and really ill people, we want to know that. The problem with this whole thing is that it's like setting a thermostat in your house, but not knowing what the temperature is going to be for 2 or 3 weeks.
Right.
It'd be almost impossible to really get that right. So we have to remember that if we do something today, we may not see any significant change in the number of cases for a while. And then by that point in time, it's hard to kind of ratchet back down, which we don't really want to do that. We don't want to open up and then have to close down again later. So it's a tricky time. We just have to really think about all these metrics, tests that are positive, how many people have had the infection, how many people now have antibodies to the infection, how many people are in the hospitals, that type of thing.
Okay, next one for you. There's been a lot of discussion lately about people being treated for things beside coronavirus. That's been coming down. What concerns do you have? Are people so focused on the COVID that they're ignoring symptoms of, say, heart attacks, for instance? Are those people coming back into the hospital?
I think they are. I think patients are starting to understand that they're much better off getting their symptoms looked at and having their medical conditions treated in the hospital when it's appropriate. I think most hospitals, including ours, saw a decrease in the number of people coming into the emergency department and coming in with a variety of medical illnesses that we normally expect to see, because I think people were afraid to come into the hospital, frankly. I don't think that they should be afraid to come in the hospital when they're having symptoms that need to be checked out. Certainly, if somebody's having concerning symptoms like they're having chest pains or they're having signs of a stroke, anything like that, significant abdominal pain, et cetera, those patients should come in. They're better off coming into a hospital and getting checked out as opposed to trying to tough it out at home or something like that. Because now hospitals have really a lot of procedures in place to keep folks safe and separated if there's COVID-19 symptoms and that kind of thing. So we're starting to see, I think people are recognizing they need to be looked at.
So is it okay for people to come in, next question, for a physical or routine office visits? Is that now that, hospitals are relatively welcoming?
I think it depends on the office setting. I mean, there's a lot of options for virtual visits, which, patients can get seen virtually, and then there's no risk of being exposed or exposing others to COVID-19. So if that's a viable option for a patient to do a virtual visit, and I think a lot of doctors' offices and healthcare systems have really improved their ability to do telemedicine, including Dignity Health. I think that's a good option. When somebody does need to be physically examined in person, then I think that we just need to make sure that there's some processes in place at the doctor's offices where people are using masks appropriately and good hand hygiene and all the normal things that we've been talking about now for weeks. If those are in place, I think it's okay.
Okay, quick question for you before we go to break. What about donating blood? Is that okay, donating and receiving blood?
Yeah, please do it. Please donate. I think that we want to make sure that the blood banks are adequately supplied. We need blood, for a variety of reasons. And so please consider donating. You can call and check in and see what their needs are. And if they're doing fine, they'll tell you, okay, come back in a couple of weeks. But I know that there's been a decrease overall in blood donations because people are trying to socially distance, which is appropriate, but we still need blood donations. So please check in and do that if you're a good candidate.
Let's get right to the next question. A viewer asking, we've been told that some groups are more at risk than others. I can understand maybe smokers and people who are weak of heart, but what about people with diabetes, high blood pressure? Are they more at risk?
Yes, so there's a number of different medical conditions that are associated with a higher likelihood of getting really ill from COVID-19. So ultimately, your ability to fight off COVID-19 and not have complications from it is going to depend on your overall health in this particular infection. And so someone who is, much, much older than the average, somebody at least over 65, but well into their 80s, those folks are at higher risk. Certainly having other medical conditions like high blood pressure, diabetes, COPD, those types of things, it reduces your overall health. They have those diseases have an effect on your overall ability to fight off the infection appropriately. So those are significant risk factors. And then we need to start to think about how do we protect those individuals as we are reopening things like our businesses in the community. How do we ensure that those folks who are at higher risk are going to be protected and okay? And that's part of the whole reopening strategy from the governor and from the counties.
Well, you mentioned the reopening strategy, and to our next question, there's a lot of talk about a second wave of coronavirus, when that may be, sooner than later, maybe the fall, maybe Jan 1. What kind of shape are we in? Are we ready for a second wave? Do you think we're going to get one?
Well, it certainly could happen. And when you look at California as a whole, it's such a huge state. There's so many different geographies and different conditions that it's hard to generalize about the entire state of California. So if you look at an individual community, you can get an assessment of how it's dealing with its current cases, how many cases have been recorded so far, how many people have had to go into the hospital, and get an overall sense of that community. But you need to make sure that the community that's being reopened has the ability to trace patients and track down whether they've had people that have been exposed to them. And then what's the plan to isolate those individuals, to quarantine those folks? Is there enough capacity in the communities to deal with a higher number of cases? How are we gonna know? How are we gonna really identify those people? Do we have enough lab testing in that community to make sure that we can track this effectively? Because as we talked about earlier, you aren't going to know what the effect is for a couple of weeks when you start to reopen businesses, because it takes a while for coronavirus to get going in a community. And so we have to really think ahead a few weeks at least.
Next one for you, and obviously we're getting into warmer weather, although not yesterday or today per se, but people are going to want to go to the swimming pools or to the river. Let's focus specifically on the swimming pool. Should people be concerned about the water, or is it just the amount of people together in the pool in close proximity?
Yeah, it's the latter. You know, if you go to a public swimming pool, especially, and there's a group of people all arriving there, they're coming in, they're touching surfaces, maybe they're in the locker rooms, they're they're in close proximity, and if they're not wearing masks, there's a higher risk. I don't think there's a huge risk of getting the virus from being submerged in the water itself, but I think it's being around other individuals is the much more likely way that somebody's going to catch COVID-19 in that particular setting. So I think that as we all are starting to make decisions about what we want to be doing and what kind of risks we want to take, we all have to use common sense about these things, and that's gonna help us more than hard and fast rules about it. But yeah, a public swimming pool with a lot of people at it, that could be a potential concern. You know, if you're in a pool with one other person and you're basically a distance away from them, that's probably fine.
Okay, next one. My friends and I have hardly left the house in the last couple of weeks. If we all feel fine, we don't have fever, is there any risk if we hang out for a few hours at one of our homes and with masks and social distancing?
That's a good one, you know, and I think those are some of the questions we're talking about is what's safe to do. And I was asked yesterday, you know, someone really wanted to go visit their elderly mom and just spend some time with their mom. And other people want to spend time with their friends. And it's tough to know exactly what the risk of that situation is. We do know that COVID-19 can cause an infection in a person, and they can have essentially no symptoms and still be able to transmit that infection to other people. So if your friend is coming over to your house and they've been around other people and you don't really know what their contact situation is, there could be some risk there. The risk would be lower if everybody's got a mask on and you're more than 6 feet away, and especially if you're outside. So again, I think people are going to have to use common sense with these things. And there's guidelines and some rules coming out from the government about it. But we all as individuals have to make decisions that keep our safety in mind, especially if you're talking about an individual who has risk factors like we talked about, being elderly or having other major medical problems.
Dr. Brian Evans, thank you again. We do appreciate these many visits, and you've been very helpful. And until next time.